Okay, hi, so we're back. Now our patient has had lidocaine injection in those areas that we were assessing prior and that we marked off. So you can actually see she's a bit blanched. So lidocaine mixed with epinephrine will make the skin look white, which is really nice for the person doing the Agnes treatment so they can see where they're treating. And so we've got lidocaine all the way down here on the jawline and pre-auricular area. And I have her sitting up at a 45-degree angle. I find this a better way to do treatment versus laying flat, because what happens when we lay flat, then the skin goes back like this. And really, we don't have a really true reality of how the skin is sitting when it's laying back. So I prefer to do this at a 45-degree angle. Over here on my cart, I'm set up. I always have pen and paper because I'm gonna make notes. I'm gonna jot down the number I do pre-auricular. That's gonna be separate from how I'm treating the jawline down here. So I have my pen and paper ready. I'm using the F1A needle. So it's always F1A from jawline up. When we go jawline down and we are debulking submentum or anywhere else on the body, we can use the F3A needle, but I only use F1A on the facial area. And I like to use peroxide to clean my needles. I think it cleans that a little bit better. The needles can get charred. And so I have 4x4s also ready. Sometimes you can have a little bit of blood. So I just prep myself right here, and I'm gonna go ahead and get some 4x4s ready with some peroxide on them so I can make it as minimal as possible of having to turn around constantly. Okay, so I've got my needle already in my device. I have a couple other needles ready here for me. Needles can bend, or they can get too charred, or they can get a little bit dull. So I like to have needles ready. I'm going to turn my machine on, and for the pre-auricular area, I like to use an advanced number. This is level 9. On the pulse width in the millisec is going to be 600. And that's the only area on the face that we go up this high. So I'm going to hit ready, so I'm ready. And I'm going to come over with our model today. And I'm gonna check first that she's numb. So it's always a good thing to pause at any time and make sure the patient is numb. Can you feel any of that? Is it pressure? That's good, that's a good thing. That's what we want. So when we're treating pre-auricular, what I'm wanting to do is fuse the connective tissue up and back. So if I just come back like this, that's really not how I would want to see the skin lifted. You can see that that wouldn't be my goal. I would really prefer to go up, okay? So I'm gonna kind of go up and I'm gonna go back. I'm going perpendicular straight in. You okay? Mm-hmm. And I'm gonna pulse, a double pulse. And that's it. And I'm gonna try to do 3 rows of that. I'm using my fingers to see, put the tissue where I want it to go. So remember, I came down here with some numbing because I really want to lift and pull back the jawline. And I can really get a nice little tuck back here. Okay, so I'm at 110 pulses. So what I'm going to do is I'm going to pause just for a moment. I'm going to write that down. And then I'm going to come down here and work on that little, like a little pouch that we're going to use and debulk some of that fat. So those are different numbers. So I'm going to go into standby. I'm going to lower this down to 450. That's my favorite number for that. I'm going to reset my pulse count and hit ready again. So I'm going to come and I'm going to pinch this area right here. And I'm going to go in perpendicularly. And then double pulse, I'm turning angular. Perpendicular. and you can hear that sizzle. So that nice sizzle is that fat cell that we're destroying. I'm not going to need to do a lot of pulses here. It's not a very big area. Okay, I've done about 42 pulses, and I'm going to come in at an angular direction now. This is called a tacking pulse. And I'm just starting to see that my needle is getting a little bit bent. So to be honest with you, I'm going to change out my needle. Put a fresh needle. And if you keep everything right here, then you can move quickly. Okay, so I'm going to come back in. I'm keeping it the same numbers. And I'm pulling the skin in the direction that I want it to go. And again, you can hear that sizzle. So you know we're getting some fat as well, but we're also tacking the tissue back, tightening it. Okay, so I'm going to write down my pulse count on that because that's the area I wanted to debuckle. And then I'm going to reset that. And now, because I numbed this whole area right here, I'm just going to do the tacking. So I just want to try to get as much tightness as I can. Just one pulse. Okay, so I feel like I've covered the whole area that we wanted to treat. This would be a person that I would want to do 2-3 times, for sure 2, and probably a 3rd time. I would keep that separate, 3 months in between treatments, because this little area that we debulked, that fat pad, your body is dumping those fat cells for several months afterwards. And I could tack this area back here within 8 weeks, but we'll just keep 3 months in between. So we're done on the left-hand side. Super excited to see the results. You know, instantaneously start swelling a little bit. So the swelling will go down and then we'll retreat.